Hi, I'm Adam Hawkins, physical therapist with Franciscan Health Physical Therapy. Wanted to talk to you today about our Sports Metrics program. It's a program that we've implemented, very well researched, to help prevent ACL injuries with our athletes. It's a program that we can also use if they've actually had the injury and we need to go through the rehab process. It's a three-step program that utilizes a testing phase. So we utilize software from SportsMetrics to video a series of jumps. We do a drop jump analysis, a single leg squat. We do a single leg hop. And then basically what we're able to do is break down the video frame by frame and measure the angles at the knee, the hip, calculate the knee separation distance, and compare that to well-researched data. And that helps us determine if the athlete's ready to return to sport. The second part of our program is a 6-week training program. That's something that we can incorporate in the clinic with our patients, or that we actually go out to our schools with and work with the athletic trainers as more of a preventative measure. The 6-week program is meant to progress the athlete through a phase of strengthening and plyometric training to improve their neuromuscular control and decrease the risk for injury. The third part is a shortened version of that 6-week program that we call the WHIP program. It's a warm-up for injury performance and prevention that is basically designed to be used more in season with athletes. That way they're given more time during practices and we're not fatiguing them for their games. The advantage of the SportsMetrics software is that it allows us to video record the patients performing these tests so that we can use the software to analyze the jumps to break down their mechanics, analyze their hip angle, their knee separation distance, aspects that have been proven through research to help determine the risk for injury. We are then able to take the report, show a pre-test and a post-test to the patient. We're able to show them how those angles have changed, how they've improved, things we may still need to work on. We can then take those and apply them directly to their specific care. It helps us determine the best treatment for the patient. The nice thing is we can also provide that information to the athletic trainers at their school and to their physician, for the physician to help decide whether they are cleared to return to sport. So the usual time frame for incorporating the SportsMetric test is to begin for those athletes that have had surgery at about 6 months post-op. That's the standard that we have determined that it's safe for an athlete to participate in the SportsMetrics program. As I mentioned, that'll be about a 6-week training program, and then we will provide the results to the physician. Although this program was originally developed for female athletes who are more at risk for ACL injuries, I think it's important to point out that it has been well incorporated also with our male athletes, as well as our weekend warriors, and really, in general, anyone with a lower extremity injury. Hips, knees, ankle, they all require proper mechanics, so I'm able to incorporate that with several of my patients. We analyze that information with them and help them understand if they're ready to return to sport. For more information about SportsMetrics and ACL injury prevention and recovery, visit franciscanhealth.org/rehab.